Good morning, everyone. Welcome to the 7th Annual Head and Neck Patient and Caregiver Education Symposium. I'm so happy to see so many of you here today despite the weather, and a good number of folks online as well. So welcome to everybody. My name is Heather Starmer. I am a speech pathologist, and I direct the Head and Neck Speech and Swallowing Rehab program here at Stanford. And so it's my pleasure to be here today, acting as sort of an MC as we go through our program, which I think you'll agree is a pretty fantastic and interesting program this year. So just a few statistics for those of you who maybe aren't aware. Head and neck cancer accounts for about 4% of cancers globally each year. So it's not necessarily the most prevalent of cancers, but as we all know in this room, it's certainly one of the most impactful cancers. We have about 55,000 new cases of head and neck cancer in the U.S. annually and about 900,000 cases globally. So this is a pretty big issue that we are tackling here. Now, we know that there are a lot of consequences of head and neck cancer, and that's why we fill this room every year with people who come back year after year, because there are so many different things that you as survivors and caregivers are dealing with. And so we know that this can include things like nutrition challenges, things like swallowing problems, swelling or lymphedema, maybe pain, maybe some cognitive issues, potentially some issues with neck and shoulder function, impacting golf games, as I heard from somebody this morning, maybe some dental concerns. And so we have a lot of different things to talk about, and that's great for planning this program because every year we can do something a little different. But I also want to nod to our caregivers in the room as well, because our caregivers take on a lot as well as they are supporting their loved ones. And so we know that individuals who are caregivers for patients with head and neck cancer have an increased risk for things like depression, anxiety, PTSD. Many of our caregivers, there's been a lot of research that has shown that many of our caregivers feel ill-prepared to take care of their loved ones as they go through treatment and into recovery. And so what we hope to do with this program is to try to fill some of these gaps for both the patients and the caregivers and provide resources to both of you to support you through difficult times around treatment, but also through survivorship. So we have a few goals for the day today. Our first goal is to support excellent quality of life in both survivors and caregivers by educating you about options and things, opportunities. We want to provide you with high-quality educational information. We know the internet has a ton of information, but some of it is not necessarily in that high-quality space. So we want to provide you with good speakers and good information. We really like the facilitation of connection between other patients and caregivers. So many of you maybe have met each other in the waiting room at radiation therapy, but oftentimes this feels like a lonely journey to some people. And so giving people the opportunity to connect and share their experiences is valuable. And then we also want to highlight the different services that we have available through the Stanford Cancer Center. So we have a lot of different services that are meant to support a lot of the issues that you may be dealing with, and we want to make sure that you're aware of those opportunities. So we have a pretty packed schedule today. This morning, we are going to start with our patient keynote address, and then we're going to have a couple of talks that deal with cognitive issues and cognitive challenges related to cancer treatment. Then we'll have a couple of speakers talking about dental considerations, which I know is always a hot topic. We'll take a little coffee break around 10:30, and then we'll have a survivorship panel, so individuals speaking about specifically issues after treatment and living well. And then we'll take a break for lunch. When we come back in the afternoon, we're going to have a couple of talks about hearing and ear-related issues that can happen related to head and neck cancer treatment. We'll talk about nutrition and swallowing, both from a professional as well as a patient caregiver perspective. Then we're going to have two speakers talking about sleep, which I think will be a benefit to everybody in the room, regardless of whether you've been through cancer or not. And then finally, we'll end the day with our general medical Q&A panel, where we'll have members from surgical oncology, radiation oncology, and medical oncology all speaking. So if you haven't already, please take some time to chat with the folks in the lobby, our vendors who have wonderful educational information about services at Stanford. We thank them all for being here today. and highlighting what they have to offer. I want to give thanks to our planning committee. So this is a pretty heavy lift to plan this event every year, and it does take a village, and this is a really fabulous village of individuals. So thank you to Jocelyn, Jennifer, Hope, Lily, and Teresa for all of their work going into planning this. And then we have a ton of people who are here today helping to run this and make sure this event runs well. So I want to give special thanks to all of you who volunteered your time to be here with us today and help run the event. And then finally, I want to give particular thanks to Liz, who is my new wonderful administrative assistant. And I think she's not in the room to hear me talking wonderfully about her, so I'll have to do it again later as well. But Liz just stepped into the role as an administrative assistant for a couple of us on the head neck team just in the past few months. And she's really jumped in and, put a lot of effort into putting this together. So I really want to thank Liz. And some of you may actually recognize Liz because she used to be a medical assistant in our clinic. So she actually said when she was looking at the RSVP list, she was excited to see some people who she had met in her prior role. So we do have, we're live streaming as well. So for our virtual attendees, please feel free to post questions in the chat. We do have Jocelyn manning the chat today. And we will certainly answer questions as we are able to. And then if you have any issues connecting, Jocelyn will be available on email as well. So for those of you who were here last year, you may be familiar with the Move-a-thon. So the Head and Neck Cancer Alliance is a wonderful organization that provides support and educational information for people with head and neck cancer. So this includes things like educational webinars. This includes a gas card program to help people offlay some of the financial costs, and other things like peer mentoring and things along those lines. So the Head and Neck Cancer Alliance does a lot of really wonderful work, and every year they do, or this is the second year, so year after year, they do Move-a-thon. And so the Move-a-thon is a great opportunity to give back to the organization to support some of their programs. And you can do it by moving in any way that you want. It's not that you have to run a marathon. It's not that you have to do any particular activity. Any movement can count. So last year, Team Stanford, which included members of our medical team as well as many of our patient survivors, raised a little over $5,000 for the Head and Neck Cancer Alliance. And so we're hoping to do that again this year. So I would invite anybody who's interested to join our team. There's a flyer in your packet today that has a QR code that you can scan that will allow you to join our team. If you have any issues with that, you can email me and we'll work through that. For the online attendees, you have this flyer that's been emailed to you as well. So please feel free to join us for the Move-a-thon.